It's severe for 6 months before admission. Part C, heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output, the amount of blood pumped by the heart each minute for the body's needs. It may involve the left side of the heart, the right side, or both. In left heart failure, the main symptom is breathlessness. The symptoms of right heart failure include peripheral edema or swelling, beginning in the feet and ankles. This is called as pneumodema. When a finger is pushed into the swelling, it causes a small depression or P. We have here a heart, and we have here some names that we're gonna be reading. Pulmonary artery, pulmonary veins, mitral vein, septum, tricuspid valve, and aorta. Exercises for page 52, the heart and circulation, part 1. Exercise 22.1. Complete the conversation based on the case history in B opposite. Doctor, what seems to be the problem? I've been getting palpitations. How long have you had them? For about 6 months. But I've had heart problems for years with tiredness and shortness of breath. In the end, I couldn't walk more than 100 meters without having to stop. I had to sleep on 3 pillows. I had a mitral valve replacement 3 years ago, and that improved things for a while. Exercise 22.2. Make word combinations using a word from each box. 2 words can be used twice. Look at B and C opposite to help you. At rest, atrial fibrillation, cardiac output, heart failure, effort, pneumodema, premature beats. Exercise 22.3. Write the words a patient would use to describe the symptoms below. Look at A, B, and C opposite to help you. Dysphonia, shortness of breath, arrhythmia, palpitations or irregular heartbeat. Orthophonia, having to sleep raise up. Edema, swollen ankles or swelling. 22.4. Complete the case report. Look at A, B, C to help you. Case 13. A 60-year-old woman attended her GP surgery complaining of breathlessness on effort. This had been increasing over the previous 8 months until it was producing problems at around 500 meters walking on the level. There was no history of chest pain. She had had several attacks of fast beats, which lasted 20 to 30 minutes and were associated with some shortness of breath. She had noticed some swelling of her ankles by the end of the day. This disappeared overnight. We have finished. It's now the turn to read the last practice. This is the 23, and it's a part 2 of heart and circulation. We're gonna be reading this, and after that is the exercises. After I'm just finished with the exercises of the page 54, I'm going to be reading in another video in Spanish. Okay, the heart circulation, part 2. Part A, physical examination. Medical examination is normally carried out in 4 stages: inspection or looking, palpation or feeling with the hands, percussion or tapping with a finger, and auscultation or listening with a stethoscope. Note, the verb is palpate, the noun is palpation, not palpitation. Part B, examining the heart and circulation. Here is an extract from a textbook description of how to examine the cardiovascular system. We're gonna be reading this to start. Look at the lips, tongue, and nose for the blue discoloration of cyanosis. Cyanosis may be central or peripheral. Inspect the hands for clubbing. Feel the radial pulse at the wrist and know the rate and rhythm. The pulse may be irregular in force as well as time. Check that the other peripheral pulses are present. Measure the blood pressure and assess the jugular venous pressure or JVP. Palpate the chest for the apex. Beat The normal position is the fifth left intercostal space, 1 centimeter medial to the mid-clavicular line. Feel for any thrills. Heart size may be measured by percussion. Listen for murmurs and other abnormal sounds, for example, friction rubs beginning at the mitral area. Murmurs may be soft or loud. A harsh murmur is loud and rough. Note the time of any murmur in relation to the cardiac cycle. The most common murmurs are mid-systolic, in the middle of systole, pan-systolic, early diastolic, mid-diastolic, late diastolic. Continue by listening at the tricuspid, aortic, and pulmonary areas. Areas of auscultation. The letters indicate the approximate position of the heart valves. P. Pulmonary valve. A. Aortic valve. M. Mitral valve. T. Tricuspid valve. The circles indicate the position for auscultation. For cardiac murmurs, indicating valvular heart disease. The ribs are numbered. And we have the exercises for the page 54 of the Heart and Circulation Part 2, practice 23. It says 23.1, complete the table with words. Complete the table with words from A opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. We have the verb and noun. Auscultate, auscultation. Examine, examination. Okay. Examine, examination. Inspect, inspection. Palpate, palpation. Percuss, percussion. 23.2. Put the steps for examining the heart and circulation in order according to the first stage. Measure the heart size. Percussion. Are there any murmurs? Palpation. Feel the right radial pulse. Inspection. Look for clubbing. Palpation. Locate the apex beat. Palpation. Not any thrills. Auscultation. 23.3. A doctor is presenting the case of a 43-year-old woman at a meeting in the cardiology department. Complete text of her presentation. Look at B opposite to help you. On examination, she was pyrexia with a temperature of 38.5. She was short of breath. Her pulse was variable between 1 and 180 and was irregular in time and rhythm. Her blood pressure was 130/80 and her JVP was up 5 centimeters, showing normal movement with respiration. Her peripheral pulses were all present and there was no clubbing or cyanosis. Her apex beat was displaced to the anterior axillary line but is still in the 5th intercostal space. Her beat sounds were very interesting. When she was initially examined, it was noted that she had pain systolic and mid-diastolic murmurs. Her best at the apex. When she was examined some hours later, there was a harsh pericardial friction rub all over the pericardium. Our diagnosis at that time was of mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation. Okay, it was all. We have just finished with all the practices. It is now the turn to read everything in Spanish. Remember, I'm going to be having all of that in another video. Keep going, keep watching.